Welcome back to our channel. In today's video, we will discuss autism spectrum disorder, its causes, signs and symptoms, diagnosis and treatment. Autism spectrum disorder, ASD, is a range of neurodevelopmental disorders that involve delays in the development of many basic skills and functions, including the ability to socialize and communicate. ASD includes conditions such as autism, Asperger's syndrome, childhood disintegrative disorder, and an unspecified form of pervasive developmental disorder. In 2013, the American Psychiatric Association reclassified pervasive developmental disorder to autism spectrum disorder, and the term PDD is no longer used. The condition begins early in childhood and lasts throughout a person's life, causing problems with functioning in society. ASD is estimated to affect about 62.2 million people globally as of 2015, with males being more often diagnosed than females. The exact cause of ASD is unknown, but research suggests that genes can interact with environmental influences to affect a child's development in ways that lead to ASD. Certain factors that may increase the risk of developing ASD include a family history of the condition being male, having certain genetic conditions such as Down syndrome, Fragile X syndrome, and Rett syndrome, having older parents being an extremely preterm baby, born before 26 weeks of gestation, other disorders such as tuberous sclerosis. Symptoms of ASD usually appear by the age of 2 years and can vary widely in severity, ranging from mild to disabling. People with ASD generally have problems with social communication and interaction, as well as patterns of behavior. Social communication and interaction symptoms: poor eye contact and lack of facial expression, failing to or being slow to respond to someone calling their name, resisting cuddling and holding, preferring to play alone. Difficulty with verbal communication, including problems using and understanding language. Difficulty with nonverbal communication, such as interpreting other people's gestures and facial expressions. Difficulty sleeping. Aggressive behavior. Difficulty expressing emotions or feelings and being unaware of others' feelings. Unusual tone of voice that may sound sing-song or robot-like. Patterns of behavior. Performing repetitive movements such as rocking, spinning, or hand flapping. Having an over-interest or fixating on an object or activity. Performing activities that can cause self-harm such as headbanging. Being more or less sensitive to sensory input such as light or noise. Developing specific routines or rituals and becoming disturbed at the slightest change. Having food preferences such as eating only a few foods or refusing foods with a certain texture. There is no specific medical test to diagnose ASD. To make a diagnosis, a specialist may recommend genetic testing to identify a genetic disorder such as Fragile X syndrome, Down syndrome, or Rett syndrome. Observe the child and ask parents or guardians about the child's social skills and behavior development. Give the child tests that cover hearing, speech, language, developmental level, and behavioral issues. Follow the criteria written in the Diagnostic and Statistical Manual of Mental Disorders, DSM, published by the American Psychiatric Association. There is no cure for ASD, but intensive early treatment can make a significant difference in the lives of many children. The goal of treatment is to improve the child's ability to function by reducing symptoms and supporting development and learning. Treatment options include therapies, behavioral and communication therapy, educational therapy, family therapy, speech therapy, occupational therapy. The type of therapy depends on the child's needs. While the core symptoms of autism cannot be improved with medications such as antidepressants can help control anxiety, and antipsychotics can help with severe behavioral problems. Thank you for watching our video on autism spectrum disorder. If you found this information helpful, please like and share the video. Also, don't forget to subscribe to our channel to stay updated on our latest videos.